Good afternoon, everyone. I'm KellyLunsford. I'm doing our Preceptor development today. And in trying to think of a topic to come up with, I had no idea what I wanted to do. And I was like, I feel kind of burned out. I don't know what to talk about. And then it dawned on me, maybe I should talk about burnout, because that's something that we might all be experiencing a little bit, especially given the way that 2020 has been, with COVID and furloughs and working from home and all those things. So I thought it would be a good topic to bring up for this session of Preceptor development. Point of this session here today is for everyone to take an honest reflection of their current state of well-being. So I'm going to talk more about recognizing the signs of burnout and not so much about, what do you do? Like, what are some mitigation strategies? I think a few sessions ago, we had Andy and Donna do a mindfulness meditation session. That's probably better geared for that sort of subject as far as like strategies to help mitigate or prevent burnout. But today we're just going to talk about like recognizing the signs that you may be going down that path. So what is burnout exactly? Well, I found this quote when looking things up related to burnout. This actually came from a Harvard Business Review article, and I believe this was a person who worked in finance who quoted this, but she said, I felt like my body was running on adrenaline, trying to do a marathon at a sprinting pace all the time when describing what it felt like to be burnout. Webster's Dictionary defines burnout as the cessation of operation, usually talking about a jet or rocket engine, but I do like the way that this just basically says cessation of operation, like you stop functioning. But I think more applicable to what when we think of in the sense of burnout, talking about job-related things, it's more of a exhaustion of physical or emotional strength or motivation, usually as a result of prolonged stress or frustration. And actually, ICD-11 has a definition for it. It's classified as an occupational phenomenon rather than a medical condition, according to the ICD-11. It's a syndrome resulting from chronic workplace stress that has been unsuccessfully managed. This could be represented by feelings of energy depletion or exhaustion, increased mental distance from one's job, or feelings of negativism or cynicism related to one's job. And this could result in reduced professional efficiency. It was actually first categorized as a term in the 1970s by someone named Christina Masloch as an issue arising among professionals working in human services. So basically those who take care of others. And she defined it as work-related mental and emotional exhaustion, which may be associated with physical symptoms. Who is at risk? Well, we are. People who take care of other people are at the highest risk. So that includes healthcare workers, so us, so doctors, nurses. There's a lot of literature relating to physician burnout, nursing burnout, other healthcare workers. It could also be applicable to teachers, social workers, more so now, especially given the way things have, the dynamics of the workplace have changed so much given all the COVID-19 mitigation strategies. And as I mentioned previously, those key indicators are cynicism and detachment from one's job, overwhelming exhaustion, or a diminished sense of personal accomplishment. I looked to see if burnout was something that comes in stages. I'm like, is this a stage phenomenon? Is this like a process? Like, how is this defined really? How does that work? But as you can see from this little snippet of my Google search, it really depends. I don't think it's well defined. So this psychologytoday.com says it's a continuum, or this other website said there's 6 stages of burnout. Well, according to the website right below it, there are 12. So who really knows how many stages there are of burnout? I don't think that has been really well established, but from my reading and research, I did find that there were really 3 distinct parts. It weren't so much stages, but just kind of the piece of the burnout pie, if you will, for lack of a better term. So really, it's just that emotional exhaustion, depersonalization, and then that lack of personal accomplishment. So a feeling like, what I'm doing it doesn't really matter. I'm not getting anything out of this. I'm just really going to work and going through the motions. I don't feel anything for the people I'm taking care of anymore. Kind of those sorts of things. So I have here as another title, Stages of Burnout, but just like I said, those aren't really like stages per se, and they could be kind of cyclical. You could be feeling all three of these things at once. You could just be, feeling each one piece one at a time, maybe 2 out of 3. It really just depends. And what are some of the things that lead to burnout? And I think, especially 2020 has just been a weird year, the way things have been going. And I think some of the things that may have, relate to burnout this year wouldn't apply to last year. And so we have all these new different things going on. But just to put it like simply, in the most simplest of terms, it's kind of a balance between those individual factors and maybe the system factors that are related to your job. So individual factors being, how resilient are you? Are you able to adapt and overcome to like the changes that are going on in your workplace or in the world, or changes in the world that affect your workplace? Are you more like that match at the beginning of the presentation that just burns up? Or are you more like glass that grows into molded into something beautiful whenever it's put into the fire? So how resilient you are can affect how susceptible you are to becoming burnout, or how like even the most resilient people might still get burnout at some point throughout their career, but maybe it just takes them longer to get to that point. And then thinking about system factors that kind of relate to that, it could simply just be certain policies at your workplace that affect you in a certain way. Or I think particularly now, that's more applicable to this past year would be those factors that caused us to, work from home more. That to some people that could be, a blessing. Like for me personally, I live by myself and I have a pretty good audio-visual setup in my home office. So working from home, depending on what shift I was on, actually worked out really well. But then you could be in a situation where you have kids at home, or like a significant other or pets or something that just makes working from home very stressful. And it's more stressful in the sense that you're unable to have a quiet place to do your job, or it's really hard to detach and separate your home life from what you're trying to do work related. And so it can actually be more stressful than going to work. It's in and of itself. Or you could be one of those frontline folks who, our medicine pharmacists, our adult critical care pharmacists, those who were like actually taking care, or ED pharmacists as well, taking care of the really sick COVID patients, up on the units, and, thinking that my workplace is more stressful now because there's all these like really sick with people with this highly contagious disease. And yes, I have all of this PPE, or no, I'm not going in the rooms, but it's still stressful because you still worry about catching the virus and then bringing it home. And that could lead to quicker burnout. And then also thinking about, the financial mitigation strategy period that we just came from. Our hours got reduced, but the workload really didn't change. And so that could lead to quicker burnout than, and then maybe normally you would be feeling this time of the year. So those things coming into play. And then now, even as, that period is over and we're back at work, we're not getting furloughed anymore, at least at this point. And you have all this work that you have left that had just piled up during that period, and thinking about, how I'm going to get this stuff done. How do I want to prioritize this? And it's just like exceedingly stressful, more so than it would otherwise be. But then to kind of like tie this into us being preceptors, we have to think about also, yes, it is the beginning of a rotation year. It's the beginning of residency, but we also have to consider that maybe our students and our residents are already coming into this a little bit burned out, thinking that for the students that, they have had the stress of the change of the way things, that the dynamics of like their classroom learning, they're, doing everything online, and then that presents its own types of challenges and stressors for them. And then finally getting to come back on rotation, and the hours have changed, things have changed a little bit for them. So they might already be susceptible to burnout, even though it's only June. Same for our PGY1 residents who just came in and started their residency, but them coming off of being, in school and had like a very weird end to their actual like pharmacy school career. And then our PGY2s coming off PGY1, they, without like a significant break, things were a little bit different at the end of their year. How the things that we're doing now to try to still work within the COVID environment, that with all those weird COVID related stresses that, you know, they may be susceptible to burnout early. So just making sure that we're watching not only out for ourselves, but also for our learners as well. Making sure that, you know, if they are feeling burned out, that we're helping, you know, them navigate through that. I wanted to touch on a little bit of stress versus burnout. So what are the key differences between that? I kind of think mostly that a period of prolonged and unrelenting stress will eventually lead to burnout, but just to kind of like distinguish the two terms a little bit. So stress is more associated with over-engagement. So you're constantly stimulated. Maybe your reactions emotionally, you're a little bit hyped up, or maybe you're quicker to anger about certain situations, or you feel like you have to get everything done right now. And that might be the case, you know, coming back from your furlough periods or your reduced hours, and you have so much stuff to do, and I feel like I have to get it all done. Everything like is an emergency, needs to be done right now. And so all of that can kind of lead you to feeling a loss of energy, feeling a little bit anxious, and it can really just be physically and emotionally taxing, especially because you're expending so much more energy than you otherwise would be, feeling this stressed and hyped up all the time. And that could lead to kind of the other end of the spectrum, where if you're burnt out, you're, you know, just disengaged. Your emotions are, instead of being hyped up, you're just feeling blah, like, I don't really care about any of this anymore. Like, why does this all matter? What am I still doing this for anyway? And that goes along kind of with a sense of helplessness and hopelessness. You're not feeling very motivated to do any of it anymore. And like, well, I just have all this work to do. I'm not going to get it done quickly anyway. Why am I even bother? Or then you just kind of feel detached from your job and maybe even a little depressed about it, which in and of I think it's also physically taxing to feel this way, and emotionally as well, having just feeling drained, like you don't want to do anything anymore, which is not a good place to be. So pharmacist burnout. I said before, there's a lot of literature out there about relating to physician burnout and nursing burnouts, but I wanted to speak, of course, more specifically to us as pharmacists. And it's not just something that happens within the United States. There's a couple of other articles quoted from this AJHP article that I found. So in 2001, there was assessment of burnout and coping strategies of pharmacy personnel in community hospital and in executive positions in South Africa, and 39% of their pharmacists exhibited what they called moderate to high levels of emotional exhaustion, which is one of the pieces of the pie of the kind of pieces of burnout, if you will, that I described earlier. And then even 30% of pharmacy technicians also exhibited that as well. And then in 2007, a study of Turkish community pharmacists revealed that they had low levels of personal accomplishment with their job as well. And then one survey in the United States, actually out of Duke, a really good friend of mine who I've known since before pharmacy school, was a lead author on this. So in 2018, they sent out a study at Duke. This was actually published in 2018 and presented, I think, at the 2018 mid-year conference. So they sent out this survey, which is called the Maslow. So the Christina Maslow that I had mentioned earlier a few slides ago. So the Maslow Burnout Inventory Human Services Survey. I think there also exists now another one that says -MP, which is for medical professional, which I didn't look at. I just, on a subsequent slide, I'll show you exactly what this survey is. But anyway, so they sent out the survey to pharmacists, and I think it was around 300 and some personnel who responded, but 84% of pharmacists, even in 2016, practicing in university health systems were expressed feelings of burnout. 64% of those were clinical pharmacists. And something that I thought was pretty interesting, that the levels of burnout that were exhibited amongst these people were pretty similar regardless of how many patients they took care of. What wasn't really characterized there, though, were like the acuity of those patients. So maybe some, like, let's say critical care pharmacists have fewer patients, but they're sicker, versus maybe someone on an acute care unit who has more patients, but they're not each as sick. So maybe that had something to do with it. I'm not really sure because it didn't say, or if it did, I missed that part. But then also amongst those surveys, there were also residents and fellows, and about 14% of them, of the residents and fellows, exhibited some signs of burnout. So what does this survey actually entail? I did a search, and there were like several sites that were paid sites that I didn't want to pay for, obviously, but there's like the Survey Monkey, which I didn't take it because I wasn't quite sure what let me see if this works, where the results went. I don't know if you'll be able to see this. Can you guys see the web browser? Anyone?
Yes, we can see it.
All right, thank you. So this is just an example of what the survey looks like. There are 22 statements, and they kind of groups you based on each of these statements. When you take it, it'll kind of give you like the layout for each of the three categories that I had alluded to earlier, like depersonalization, emotional exhaustion, and I forget what the third one is. But once you take it, it kind of groups you like into what your percentage is on each of those categories. And I just wanted to like let you all see what that survey looked like. So basically what that is a validated instrument that addresses feelings of emotional exhaustion, depersonalization, and personal accomplishment. That was the other one. So this is still relating to that survey out at Duke. So of the 329 health system pharmacists that were surveyed, 37% had scores indicating a high degree of emotional exhaustion. 32% had scored high on having feelings of reduced personal accomplishment, and then 20% scored high on the depersonalization category. And 53%, so half of the respondents had scored high on burnout in at least one of those three areas. So that's a lot. I mean, it's still a small number of people surveyed, but still it's kind of discerning that even, then I can't imagine like now if we had a group that took the survey, what that would be given all the things that have happened so far this year, what that would look like. So as far as risk factors for us specifically, so for those that work in the community, time constraints, I think that applies to everyone. And then working hard to meet certain performance metrics. So whether that be the number of prescriptions that you fill in a day, or time to answering the phone, or whatever the metrics are that you're working to try and to achieve, that can be very stressful. Lack of control at your job. So that could be potentially, let's say, insurance. You can't really control what a patient's insurance will cover. And sometimes, people yelling at you for things that are not your fault, but it's hard to explain to someone who doesn't understand that it's not your fault, because you're the person that's the face of to them, you're the face of, the pharmacy and the drugs, and they don't understand that insurance has nothing to do with you. And then also working more than 40 hours per week can be one of those factors leading into burnout. And then for the people working within the hospital, same thing, working more than 40 hours a week, or also having too many non-clinical duties, having feelings of uncertainty regarding healthcare reform, and then inadequate time for teaching is also a big one that was listed as the thing that causes us stress. I know for me personally, it's been extremely challenging even outside of the realm of when we were working fewer hours and not even having learners on site specifically, finding time within our busy day, especially since the departmental reform that happened last year, and a lot of it, I think almost most of us are hourly. I've only ever been hourly. So trying to find that time within that 8.5 hour block, or 8 hours with a 30-minute lunch that you may or may not actually take, trying to find time to, really teach your learners and take time for them, and, still get all the patient care related activities that you need to do for the day can be extremely challenging. And I know that we've, as a group, have come up with some ways to try to help with that, whether that be having group topic discussions, I think, is a big one. Or utilizing the layered learning model to your advantage. So if we have, like, for instance, on general pediatrics, this block, we have our PGY2 and then a PGY1 resident. So utilizing our PGY2 to do a lot of the teaching for the PGY1 can alleviate some of that pressure off the preceptor. So that's one way that we can help, but it just will continue to be a big challenge, regardless of how many hours we're working a day, to really find time to be able to invest in our learners is something that, can lead to us contribute to our burnout. I know I feel guilty if I don't have, like, I want to teach, but sometimes it's just, the day's not possible. So you give them an article to read, or they do some learning on their own. But it's hard not to feel guilty about that. And then I think we're all intelligent people and know the effects of stress on us, but just to, put it on a slide or on paper. So prolonged periods of stress can lead to, chronic diseases like high cholesterol, type 2 diabetes, coronary artery disease. If we're all hyped up and, like, our blood pressure is up, maybe we're not eating as well as we should be because we're just tired. We don't feel like cooking. Takeout's easier. Things of that nature. Musculoskeletal pain. I mean, chronic stress can just lead to you hurting or body aches or fatigue, GI issues. It listed respiratory issues here as one too, which, I mean, I guess, but is it stress or is it COVID? I don't know. But it's hard on your body. And if you live in that constant state of stress for too long, it's not good for your health long term. I think we all pretty much know that this is the case, and that stress is bad. Chronic stress is even worse. But it's just really hard for most of us who are just inherently type A people who want to do a good job and are invested in our work. It's just hard kind of to turn it off sometimes. And then the psychological effects, insomnia. I know I even personally have went through a period during this time where I haven't really slept the best, and I feel it some days. It's hard to fall asleep. And when you have a lot of stuff going on, in your mind, like, what's the rest of this year going to look like? Are things going to change with our students being on site, or like residents? Are we going to have more COVID patients? We don't know what the fall is going to look like. That can keep you up at night, or you can feel depressed or anxious, or both at the same time. And then, I mean, that could lead you to maybe go down a path of doing things that maybe you shouldn't. Maybe it leads to you drinking a little bit too much, or maybe you see a provider and they give you some medication to try to help for it, which is not necessarily a bad thing. But or the most extreme thing that was, I mean, I just quoted some of the stuff that was from this article. I mean, in the most extreme cases, it could lead to hospitalization. But I mean, it is really a huge stressor on your mental health, and you really just need to be cognizant of how you're feeling and what kind of path you're going down. And just to touch on some, healthy coping mechanisms, I said most of my talk was just going to be like recognizing those symptoms and kind of taking an honest look at ourselves as to, are we feeling burned out? Which, I mean, if it is, like, that's okay. You just recognize it as a first step to help you do something about it. And I think that's the most important thing. But I will mention, trying to prioritize self-care. It's hard to do. I have a hard time doing it. I'm not the best at talking about self-care, but that looks different for everyone. So for me personally, I've been walking to work a lot. I know it's really hot outside, and it's probably not like the best time of year to be doing that. And when I go to leave at 3:30 this afternoon, I'm probably going to regret my decision to walk into work this morning, but that's okay. It's easy for me to do that. I live 20 minutes away. I can fit in some exercise. I know I'm not good at getting up early in the morning to exercise. Some people are, and if you are, that's great. That's not me. Walking is about all I can do. I'm not going to get up at 5 to run, even though the temperature is more conducive to doing that. And then certainly when I get home and it's still like 100 degrees outside, I'm not running then either. But I will do maybe like calisthenic exercises or whatever in the morning before I go to work, just because I have a pull-up bar in my apartment and it's easy to do. So whatever self-care looks like for you, whether exercise, reading a book, maybe reconnecting with some friends and family that you don't talk to that much on a regular basis, or you certainly probably have not seen as much because we're not going as many places right now because of COVID. I mean, I haven't gone to see my family in a while, and I know a lot of us are in the same boat as well. So, you could at least FaceTime them, talk on the phone, reconnect with some people. But just take an honest look at how you're spending your time, especially your time, at work. Are you being as efficient as you could be, or then your time outside of work? What are you doing when you get home? Are you sitting on the couch watching Netflix? Is there something else that you could be doing? I mean, not that there's anything wrong with that. I certainly am guilty of doing that myself, but just taking an honest look at the way that you structure your time of your day. Are there some opportunities for you to improve your schedule, be more efficient, maybe help relieve some of that stress that you've been feeling of rushing, trying to get things done? Personally, I'm very much a procrastinator. Maybe try and, for me, I should look ahead and help schedule some things ahead of time so I get things done, in a more timely fashion. Just sharing some own personal things. It's all different for everyone, but then also taking a look at your schedule. I say responsibly Marie Kondo your schedule, meaning that, yes, if my job doesn't give me joy, I should get rid of it. That's not what I'm saying. But, taking away some activities that you're doing. Maybe you find yourself scrolling on your phone during all your free time, and then on Sunday it says your phone screen time has increased 487%. So then thinking about how much time that one wastes scrolling on your phone when you could be using your phone to talk to a person instead of scrolling on social media and looking at all the things that could potentially be adding to your stress, which could be exacerbating your stress, which could lead you to burnout. Other things that you could do are change your perspective, recognizing that not everything's a crisis. You don't have to get everything that's done right now. Every time you get sent an email, you don't have to respond right then. If they're sending you an email about something, chances are it's probably not an emergency, because if it was, they would call you. I know I'm guilty myself of wanting to respond to something right then and there, mostly because I know that if I don't, then I may forget altogether. But just realizing that you don't have to respond to emails at 11 p.m. It's okay. You can do it the next day. And then whenever you have an opportunity to delegate something and to take something off your plate, do it. Some people don't like delegating. Some people like to hold on to responsibilities and just want to do it themselves. But I urge you to resist the urge to do that. If you are able to, whether you delegate something to another another one of your teammates, or even a resident or a student, any opportunity you have, not only does that kind of take that work off your plate, it gives you a chance to mentor and empower someone else to do the work themselves. And so in essence, you're teaching them and helping them move their career along. And then I think I alluded to this before, but just seeking out meaningful connections. For us, mentor-mentee relationships. So if you're a newer practitioner and you're just getting started, developing relationships with some of the more seasoned preceptors and talking to them and kind of, brainstorming with them, have them help you work through maybe stressful situations, or if you feel yourself going down that road towards burnout, then seeking the advice of people who've been around a little bit longer. And then also, if volunteering is something that gives you joy, I know it's kind of tough to do that right now, but if there's any way or any opportunities to do something like that, I think, the free clinic's still going on. So that's an opportunity, or I'm sure there are other opportunities outside of the realm of pharmacy for volunteering that are worth pursuing as well. And just kind of to round it out, these are the questions that one should ask themselves to kind of give them an idea, versus you could take the formal survey and it could give you some stats and numbers. Again, though, that specific Survey Monkey, not really sure where the results go or what happens, because I was a little bit too unnerved to do it myself, but I did post it just so you could see the questions and what they were. But these are some of the questions you could ask yourself that could kind of let you see whether you're on that road to burnout. Are you cynical or overly critical at work? Do you feel like you have to drag yourself here? Are you more irritable or impatient with coworkers or patients even? Are you lacking energy to be consistently productive? And that's more so than just, oh, I didn't sleep well last night for one night and I'm tired today. But then like the next day you sleep fine and you feel fine. It's just kind of more like a chronic issue of I'm just always tired. I don't really want to do anything. I'm not really getting things done as efficiently and to the quality that I was doing them before. Is it hard to concentrate? Are you having more difficulty concentrating um, than you might normally do? Are you just like not satisfied? Even if you are doing, good things and strong work, do you just kind of feel like you're not really getting anything out of it? Do you feel disillusioned for your job? Are you using food, drugs, alcohol to feel better, or just as a mechanism to not really feel anything? As your sleep habits change? Are you sleeping less? Are you sleeping more? Also, are you bothered by headaches that you can't attribute to something else? Are you having like more GI issues or other like physical symptoms, like just like physically aches and pains, or just overall not feeling well? These are the questions that one has to ask themselves to kind of get a sense of where you are as far as your current well-being. And that's really all I have to say on the subject. Does anyone have any questions or comments?